Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm also the inventor of advanced soft tissue release ASTR specialty. I am a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. All right, Nia, tell me what's going on with your shoulder. What happened?
What happens? So my shoulder hurts when I reaching so high, and then to go back like that, it's hurting. And then I try to push something hard, it's hurt.
How much pain from 0 to 10 at worst? 10 is the emergency room. How much pain do you feel there?
Oh, 10.
10?
Emergency room, yeah.
Yeah. And how much pain do you feel right now when you move your arms?
Move around, depend on some position. If I go through really high, it's 5 or 6.
That's 5 or 6, okay?
Yeah.
Okay. What about reaching backward?
Yeah, reaching back, the same thing like
That's,
that. Yeah, I try something like that.
Let me see how much you can go back. How much pain with that?
Yeah, there are 5, 6.
5, 6, and your hand by your buttock, okay? What other motion aggravated? So upward,
Yeah,
okay?
Yeah, there are 5.
That's 5,
Yeah,
okay.
I can go further, can go too high.
So if you go further, that's aggravated.
Yeah, right.
Okay, we don't want to aggravate it now. So how long this been going on?
For August 16 until now. August 16, 17.
August, okay, that was last year, in 2017.
Yeah, right.
We currently in March.
Yeah.
Okay, so that's about like 7 months.
Yeah.
About 7 months.
Yeah.
Okay, so have you had any treatment for that?
No, nothing. Today is the first day.
Today is your first day. How did you injure it? How did you injure your shoulder? What happened? Did you fall? Did you do?
No, sir, related to my works.
Okay, so can you describe what you do at work?
It's work, I carry a satchel,
Okay.
the bag, heavy bag,
Uh-huh.
then I did the foot, when I deliver mail at the mailbox high,
Okay.
I try to jam the mail inside the mailbox.
Oh, okay.
With the paper and everything, I try to jam inside and make me feel really hurt.
Okay, so you are a mailman.
Yes.
Yeah, you just reach up high to put your mails, to put the mails in the mailbox.
Yes.
And you do that throughout the day.
Yeah.
And that's when you start to have pain there.
Yes.
Okay, so we're gonna take your range of motion before the treatment, and then we'll do the treatment and we'll take the range of motion afterwards.
Yeah.
Okay? Right. Let's lie on your back, head here. Bend your knees. So stop when you feel pain, okay?
Yes.
Okay. So thumb up, and I want you to bring your arm up towards the table and stop when you feel pain. Make sure your elbow straight. Okay, is that as far as you can go? Stop when you feel pain, okay?
Yeah. Yeah.
Okay, that's painful?
Yeah.
Can you see that? It's 145. You able to see that? 145 flexion. Remember that, okay? Alright, so we're gonna do the abduction. So thumb up, and you're gonna bring it toward your ears like this.
Yeah.
Like this. And stop when you feel pain. I'm gonna take this upwards. It's here?
Yeah. Yeah, right there.
So this is, you see here, it's 100 degrees. So 100 degrees abduction, you can just get the whole thing. You don't have to zoom it. Okay, 100 degree and 145 flexion. Okay. Okay. So let's bring it down there. Here. Stop when you feel pain. That is. Can you see this? It is 62 degrees. 60, almost 63. 63 degrees. Let's do it the other way. So internal rotation 63. And
Yeah, it's back.
it's painful.
Yeah.
It's 42. Good. Relax. I'm gonna write these numbers.
You can switch the sides.
Okay, hello? Hi. So it looks like you were on two devices. Here's the back course, and it looks like your insurance family choice is submitted to
Sterilization. Do you remember the abduction? It's 100. Okay. So we're gonna review those numbers after the treatment. Okay. So let's pull this up. So your pain in the front or the back? Where do you feel the pain? In the front?
Yes.
Okay. What kind of pain do you feel there? Sharp, dull, aching? How do you describe your pain?
Pain?
How do you describe the pain?
Yeah, pain. The pain is
It's like sharp stabbing?
yeah, sharp, and then you look like a sharp, yeah.
Can you take your shirt off?
They should be shut up?
Yes, is that okay?
Yes.
You need help?
That's okay.
Okay.
Yeah.
That's why how you compensate? Okay. So let's line your back. So your pain is right in here?
Yeah, it's right on the top, right here.
Right on the top
Yeah,
here. Okay.
yes.
Alright, so make sure what I'm doing is not aggravating your symptoms. So you had that since August 2017. We are in March
Yes.
2018. Is that painful? It's okay. Make sure this is not painful, okay?
A little bit bad.
Make sure you let me know, okay? If it's
Yes.
painful, I will adjust the treatment. I don't want you to feel pain. But you don't feel pain in the back.
No, on
just
the
in
back.
that
Yeah,
spot.
in the front. Yeah, in the top. Ah,
Sorry. You get a lot of scar tissue here. Okay. It's gonna feel cold, okay?
yes.
You feel this bump here? That's a scar tissue.
Yeah.
You get a lot of scar tissue. That's probably from repetitive strain injury at work when you did a lot of repetitive motion. You had the micro tears in your muscles, and when you have that, your body builds the scar tissue to heal. It's like when you have external paper cut, your body has to build the scar tissue to heal. But the problem when you have too much of the scar tissue, that's in the way. And instead of your muscle contract and relax like this, the muscle should act like a rubber band. When you contract and relax, it does this. It's like when you have a scar tissue, it's like you have a knot in the rubber band.
Oh.
So when your muscles stretch,
Do I know who is it?
does not stretch much because the scar tissue in the way. And you can feel those bump. You feel those bump here. That's a scar tissue. And here a lot of scar tissue here in this area. So I'm trying to break in the scar tissue so it will, hopefully we can get you more range of motion without pain. Okay? Okay.
Even though the numbers are shaking, patients come in the morning,
Make sure what I'm doing is not painful, okay?
Yes.
Okay. Yeah, you get the scar tissue here too. You feel that? You feel this bump here? That's a scar
Yeah, yeah.
tissue. Okay. So I will have you actually sit up. Okay, you can work on the back. Okay. Let me get the back here. Hello. Look straight, nice and tall. Make sure this is not painful, okay?
You know, on the back is okay.
Yeah, and you can see in the camera, actually you can see it, the scar tissue mostly in the front and the biceps, but in the back here, there's not really much of the scar tissue. It's a little bit here. I'm gonna do a couple of things after this, and then we'll try to do the motion again, okay? Yeah, so you can see the scar tissue around here, the redness, and if you come forward here, you will see more scar tissue. And so you can see the scar tissue around here here, here, around this area a little bit here. The batch look like it's fine. There's not a scar tissue. So with this instrument we can actually see the scar tissue and when we work on it, okay? So I'm gonna do a deep release and make sure it's not painful, okay?
Yes.
You're gonna feel cold, okay?
So good, sir.
Start off with your start date on
Okay.
or your.
Let me know if it's too much, okay? Pain, discomfort, it's okay. You're making faces, is that pain? Do you feel pain?
No, no.
Okay.
Yeah.
Sorry. Okay.
Yes.
Okay, so let me go ahead and slide.
Is that painful here? It's okay.
It's okay.
Okay. Okay, so let's get a front view and we'll get the whole shoulder. Let's move your arm
I'm sure we have time.
all the way up.
And
Pain? Or you feel pain? Or it's gone? You're going further. How's that?
Yeah, a little bit. Yes, still.
How much pain and where do you feel it?
Around 3.
Where do you feel it?
Yeah, it's a front right here. Right here.
Right there? Okay, let's bring it back.
Yeah, right here.
Where do you feel it?
It's a pain right here.
Right in there? Relax. In that spot?
Yeah.
Is that painful?
Yeah,
where I'm
yeah,
doing?
it's a pain.
Sorry.
Yeah.
Okay. Okay, let's scoot here at the edge of the table. Just sit here. Just sit up. Yep.
Yes, today with Ty.
Okay. So you feel it's right in here.
Yeah.
Okay.
Yes. So the one you got an automated cough vest.
Okay. Let me know if it's too much, okay?
Well, here we have her at 8:45. Okay, let me see if I can do one second. So she's saying that
How does it feel?
Yeah.
Okay. Relax.
and then she's like, oh no,
Okay. Let me get this.
he was bringing she
Make sure this is not painful, okay?
Yes.
Okay, so let's lift it up again and tell me how this feels.
Yeah, it's better.
You're going
better,
further.
Yeah.
You're going further. Do you feel pain or it's gone?
Still a little bit.
How
yeah.
much from 0 to
2.
10?
Now 2.
Where do you feel it?
I feel that how come I don't know how to look better than
Yeah, you look better.
yeah.
Where do you feel the pain? Where do you feel the pain? The location
Right
of
here,
the
the
pain?
place on the top.
In the top. Let's bring it back.
Yeah, better.
You're going back. Let me see the other side. Let's get it back, please.
the one coming in at
Okay, let's do this.
or 2:45. Yes.
Let's do this side too at the same time, both of them. Okay, so it's a little bit tight here, so we need to get it as far as we can here. Okay, and relax. Get a, you can get like a front view.
Yeah, it's just that it's all takes off like the only time you have is one.
Let me know if it's too much, okay?
Yeah. Oh,
Sorry, too much or it's okay? Sorry. Okay. We only smile on the camera, okay?
yes.
Just joking. Make sure it's not painful, okay?
Yeah.
Okay. How's that?
Yeah, all right.
Okay.
Mm.
Sorry.
Yeah. So hurt.
Sorry. Okay. You feel that tightness here, that band? That's a band of tightness.
Yeah.
So you're gonna loosen it up. Oh, sorry. Okay. All right. Don't kick, okay?
Yeah.
All right. We try to be nice in the camera,
Yeah,
okay?
right.
You can kick afterwards. Painful? It's okay.
Yeah.
Sorry. What about now?
Just okay.
Okay.
Yeah, thanks.
Sorry. Okay. Your muscle is really, really tight here. Relax, relax, relax. You got painful? It's okay. Sorry.
The one that gave you the pump.
Too much or it's okay?
Okay, so I'll go ahead and move it to the
Yes, she did, and I left her voice because she told me,
You try to do deep release in your muscles using those instruments, okay? Make sure it's not painful, okay?
Yeah.
Mm-hmm. Okay, let's try it again. All right, how's that?
Yeah.
Any pain, discomfort?
No.
That's good. Let's bring it back.
It's a little bit hard.
It's hard.
Yeah.
We need to do some more work in the back, but the front to look better.
Yes.
Okay, let's lie on your back and I will measure your range of motion again. Lie on your back. Okay, so you will tell me the range of motion here while we're taking this, okay? So I took this range of motion here. So how much was that flexion before?
145.
145. Okay, let's bring this up all the way back as far as you can without pain. So that was 145.
Oh.
Now it's 170.
Yeah.
Good. Let's bring it to the side. Abduction, how much it was?
100.
100. And bring it toward your ears. All the way. Okay. Can you see this? Okay. So we get 145. That was 100. Did you see it? Yeah? Okay. Oh, actually? Yeah. It's right here. 145. You see that? Right in here. Okay. External rotation, how much it was?
42.
42. Okay, let's bring it back and make sure you get the numbers. Okay. That is, it's like 74. That was 42. Okay, internal rotation, bring it down. How much it was?
63.
63. Bring it down. Okay. That is 65. Alright, awesome. Okay, sit up for me. How you feel?
Yeah, I feel good, doctor. I
Yeah.
feel better.
Yeah, you feel better?
Yeah.
So what do you think about the treatment?
Yeah.
Just a few minutes work on it.
Yeah, just a few, but it's feeling good now.
You feeling better?
Better than
Yeah?
can raise a hand,
Yeah?
and pull back like that.
Yeah, awesome. Yeah.
Yes.
Thank you so much.
Thank you, doctor.
Thank you. Feel free to subscribe to my channel to get updates about helpful information and tips and tricks on how to relieve your pain and your patient pain. Also, there's over 170 videos, most of them actually real treatment videos. I'm showing how I use ASTR instrument on the patient, and you can actually see the result in the video within the real treatment videos. If you are a healthcare provider, feel free to register for ASTR class so to learn how to actually treat your patient effectively. In ASTR class, I actually utilize over a 400 research study. That's actually what I use as part of the treatment, and that's what I will go over with a health practitioner to learn how to practice effectively based on research study. See you soon.